Major funding for these broadcasts is made possible by grants from Chase Commercial Term Lending and New York Community Bank, M&T Bank, Perfect Building Maintenance, Capital One Bank, the Witkoff Group, Greenberg Traurig, Genova Burns. Additional funding is provided by grants from AKA Hotels, Corman Communities, Aerial Property Advisors, AVR Realty Company, Bank of America, Merrill Lynch, Bank Leumi USA, Briarwood Organization, CBRE, Citizens Bank, Colliers International NYC, CPEX Real Estate Services, Cushman & Wakefield, Customers Bank, DDG, Dime Savings Bank of Williamsburg, Fisher Brothers, First Nationwide Title Agency, Flushing Bank, Foley & Lardner, Friedman, Handler Real Estate Organization, HAP Investment Developers, Investors Bank, James D. Kuhn Real Estate Institute at Syracuse University, James Orphanides, Chairman USRealty.com, Kilroy Architectural Windows, New York's Window Company, Madison Realty Capital, Massey-Knackle Realty Services, Matone Group, Mercantile Commerce Bank, N.A., Meridian Capital Group, Newmark Grubb Knight Frank, New Banks, MHP Real Estate Services, Optimum Window Manufacturing Corp., People's United Bank, Rosewood Realty Group, SJP Properties, Sterling National Bank, Sterling Risk, Stonehenge Partners, TD Bank, Terra CRG, the Continuum Company, the CUNY TV Foundation, the Moynihan Group, and these friends.
You know, I want to be an urban planner. I want to play. Yeah, I want to be a track and field. You know, I want to play football. You know, maybe I'll go out to Tennessee to law school. Then I'll practice law, and all of a sudden I became the CEO and president of the second largest employer in the state of New Jersey, the biggest healthcare system. I'm lucky to have Barry Ostrowsky. Thanks for being here today.
It's pretty impressive. I thank you. I'm delighted to be here.
So tell me about your parents, where they came from. You know, I remember there was Russian. And,
right.
So tell me.
I had great parents. I'm sad that my father's gone now 30 years, but my mother's still here. She's almost 91. My mother was born in Czechoslovakia, came here as a 7-year-old, her father having come before her to set up household. So she and her mother came over. Eventually there were 2 other siblings, and they lived in Newark.
So how did they end up in Newark? You know,
Our family from Czechoslovakia and Hungary had migrated to Brooklyn originally, and then a part of it broke off and went to Newark, where one of my relatives opened up a dental lab, which became a very successful business, and he helped bring everybody else to Newark, New Jersey.
So he was the patriarch.
He was the patriarch, precisely right.
Let's go about your dad's side.
So my father's family was from Russia and came over. They were born there. But my father's father, my grandfather, who I never got to meet, and he had him for only 8 years, died when my father was a little boy. And so my father grew up with his mother, a single parent, in Newark, and it's for some point in Camden, and then back to Newark, where he made friends with all the people that I grew up with as aunts and uncles.
Did you check with Mom, who's 90 years of age, who happens to be in charge of the surgical volunteer at the hospital, how she met your father?
Well, it was a blind date. And her best friend and my father's best friend were going out together, and before you knew it, there was a blind date, and shortly thereafter they became a couple. They had never known each other, although they were in Newark all those years. The community in Newark was vast at the time, and they had your own group. This was an intergroup marriage within the same community, and it worked.
How did your father get into the paint business? Because there was one relative who was in the real estate business before the Depression, I think.
Yeah, unfortunately, his father. His father was in the real estate business. The Depression wiped him out, and unfortunately, he along with it. My father had a dear friend whose family was in the paint store business. There were 2 paint stores. And so after my father came out of service, He and his friend each went into the paint business.
Now, one was in
Irvington, New Jersey, and our store was in Montclair, New Jersey. And
now, this was
Red Star Paint Supply.
Red Star Paint Supply, which was the beginning of your entrepreneurial.
No,
okay.
We all worked there. We all worked there growing up, and the lowest rung on the ladder was to take jugs and wash them out and then fill them with turpentine. That's how you knew you were in the paint business in our family, and you started that way, and that was it.
But at least you were doing that portion of the paint. You weren't the schmierer. Right?
No, I wasn't the schmierer.
Okay,
absolutely.
but
no.
you were just supplying the paint.
We were just supplying.
But
the
it
paint.
was a good good growing up situation.
You know what? It's funny. I'm in healthcare now. Healthcare now needs to get into the retail business, and you know better than anybody because of your background and commitment to healthcare in New York. We don't know how to be in the retail business in the healthcare field. I grew up in the retail business, and the things I learned when I was a little boy are transferable and need to be to healthcare.
It relates to one of my past guests who is a healthcare expert, and Herb Pardis of New York Presbyterian. Sure. And Herb worked in Lakewood. His father owned a hotel, and basically dealing with customers is the way, and that's healthcare today.
Exactly
so
right.
Consumer business, especially with the changes, which we'll talk about in a little while. So you were living in Newark, and then what happened? It was the move to the suburbs?
Yeah, interestingly, I was 11 years old. We moved out to Millburn, New Jersey, which was the suburbs.
We have a couple of pictures of you as a kid, with your siblings, and then
Shepherd Avenue, Newark.
Right, and then we have the bar mitzvah picture.
That's right.
Okay,
exactly.
so
that took place in Millburn.
When you were growing up, how did you get involved with track and field and football?
Well, I love sports, and football was something I wanted to play. It was more or less a cultural rule that Jewish boys didn't play football. Certainly in Millburn, New Jersey, that was the case. And it took a long time and a lot of persuasive discussion to have my mother sign the card. And so I played in high school, both football and track, something I was delighted to try to play in college. I got hurt playing football in college, but I spent my college career on the track team.
So let's talk, now you graduated Millburn High School,
right.
And how did you decide to go to Rutgers?
Well, embarrassingly, I looked at most schools through the athletic department. At the time, Rutgers was trying to rebuild its football program a long, long time ago. And I was persuaded to go to Rutgers as opposed to some other schools that had interested me for football, and I went there.
Which is very interesting because something that's happening today in New
Exactly.
Brunswick.
That's right.
So, as they would say, certain things go in the timeline of your life. You never realize that, especially, with the institution having Beth Israel in
right.
Newark, now maybe Robert Johnson Wood in New Brunswick, that you've been involved in these on the periphery. So when you went to Rutgers and you were on football and then you were on track, you at that time you said you were interested in urban planning. How did you get involved with urban planning?
I'm not even sure I can explain that, except that when you sit down and try to pick a major, you think about all the creative things you could do, and urban planning was at the time something that was just developing. So I chose to adopt that curriculum at Rutgers, and I spent a lot of time on it. I traveled and studied urban planning techniques in other cities, and I was committed to come out of Rutgers, go to law school, and spend my career merging law and urban planning.
I know that your mother's brother was the attorney,
right.
the member of the family who went to college, who was a professional. When did you think, when you were growing up, that you wanted to be an attorney? Was it when you were a young kid in public school or high school?
Oh, yeah, very young. Because in our family, Uncle Bernie was the role model. He was the man who had gone to college, became a lawyer, and that's what you needed to be. You needed to be like Uncle Bernie. And so Uncle Bernie was a lawyer. There really wasn't much choice. Had I wanted to be a doctor, they would have accepted that. But I didn't have that inclination.
It was in the DNA. It was in the DNA. You could be in that either way. Now, but Uncle Bernie had relocated, right?
Yeah. He had gone to University of Pennsylvania. He was going to law school here in New York at NYU, as a matter of fact, when he met a girl who came from Knoxville, Tennessee, and finished up his law school in Knoxville and had a thriving law practice in Knoxville, Tennessee, so that when I got out of undergraduate school, he said to me, look, you're going to spend the rest of your life in the Northeast. Why don't you try another part of the country? And since he was who he was in our family, I went to Knoxville and went to law school at the University of Tennessee.
How was Knoxville? I mean,
Fabulous.
here's a guy who grows up in New Jersey. You go to public school, you go to high school, you go to college, and all of a sudden you're in the South.
Well, I thought it was terrific. Knoxville is a university town, so it has all the attributes of that. Very cosmopolitan for a small city. It had its own symphony. It was strategically located a couple of hours away from Atlanta, so if you needed some dose of urban, you could get to Atlanta. The Jewish community in Knoxville was terrific, very supportive of themselves and very cultured. So we loved it. I say we because in between my second and third year of law school, I got married.
So let's talk about your first year, because you came back during the summer to
be a law clerk at the firm that I eventually joined.
So how did you get originally to Brock Eichler?
Well, another member of our family is Eichler. So when I was younger, while I was in college...
Now, Eichler is on
my mother's side.
Your mother's side.
Right. And I was an office boy at this firm. I was an office boy, an associate, a partner, a managing partner, without ever leaving this particular firm. But I was an office boy there, and I came back after my first year of law school and became a law clerk when one of the young associates decided to introduce me on a blind date to the great lady to whom I'm married now.
Right, and we have a picture of your
Right.
in-laws also.
Exactly. Fabulous
Now,
people.
so your wife was a school teacher,
School
right?
teacher, right?
Okay. Did she move out with you to Knoxville?
Yeah, for my third year of law school, she came down and taught school in Knoxville. And to this day, we say, frankly, had we not had our parents back in New Jersey, we may well have stayed in Knoxville. But we weren't about to give up that proximity and closeness.
So when did you give up working at the paint store?
I have to tell you this. My father died in 1985. I was already a significant partner in my law firm, but a delivery had to be made, and I took out a delivery. So I don't know that I ever got out of the paint business officially, but and I worked there. When I was in college, my dad had had a heart attack. So I was at Rutgers, and around practices and classes, I would go up to Montclair, and I would work in the paint store. And it was a family commitment. It was, we ate, drank, slept, paint business.
You joined Brock Eichler in what year?
Wow, I got out of law school in 75, and so I was an associate in August of 75.
Now, you were in the litigation department?
Well, I went there, presumably, to do urban planning at that moment. I started on a big piece of litigation about development in a part of New Jersey, and I spent the first 4 months on this piece of litigation, and then someone came to the firm and said, I want to build a dialysis center. And
Now,
that was it.
I don't understand dialysis and paint. I understand that, you know, sometimes you mix paints and other things.
Thankfully, there is no connection there.
Now, listening to your background, you didn't have any inkling of the healthcare. None of your relatives and nothing
Correct.
over there. And even Brock Eichler wasn't.
We are just beginning this we began a healthcare practice. So it was at a time in healthcare when institutions needed some specialty legal work, not the old-time lawyer.
And this was even before really the preponderance of the HMOs, because that took place like in 85.
That's
or
right,
later
well
on.
before that.
Okay, you were 75, so,
Right.
and this was the one with the certificate of need?
Certificate of need. New Jersey had rate regulation, so we had to argue and advocate for our clients who needed rate relief from the state of New Jersey. So the whole regulatory regimen had changed, and the typical hospital lawyer, you know many of them, had not stayed in touch with these new regulatory
Right,
requirements.
and at that time, I mean, hospitals were single institutions. There was no large systems,
That's
you
right.
know, with nursing homes, with hospices, and ambulatory. It was a different type of business.
Exactly.
And you know, getting to the Barnabas system was in Newark originally.
That's right.
And they relocated in 1965 or 66.
Yeah.
And you know, so they were over there. So you're working on this case. How do you become more of a specialist in the healthcare business?
It typically takes one case. So on dialysis, I had to learn everything about certificate of need, federal regulatory activity, building a healthcare facility in various codes, and, you know, word of mouth. So this guy knows healthcare law, so the next thing you know, you start to build a practice. And it was a very important practice. It became a significant one. And it was through this practice that I met my healthcare mentor, much like my uncle was my legal mentor.
So how did you meet Ron?
So Ron Del Mar, my predecessor and mentor, was on the board of an HMO. You just mentioned HMOs. I was representing an HMO of which he was a board member.
Which was the HMO?
Crossroads. It was an Essex County HMO that had been begun by the Medical Society of Essex County and the Hospital Association of Essex County. He was on the board. I represented it. We became friends. And through that friendship, ultimately, we became business partners.
But let's talk about that. So you joined Brock Eichler in '75.
Correct.
You progress, you become a partner, you become a senior partner, managing partner, and Ron all the time, because one of your big clients happened to be the Barnabas Hospital.
Right.
Wasn't a system at that time.
That's
it was
right,
Barnabas
one hospital.
Hospital. And we have a check over here that you signed, that you made out to Ron's wife, Peggy.
That's right.
And it's in 1985, so this is like 10 years later. What happened?
In 1985, Ron, who had started at St. Barnabas in the personnel department on a part-time basis in the 60s, was made president of the institution. And when he was made president, he wanted me to leave the practice of law and help him run the hospital. I told him no, and he put up a fight, and I took a check out of my wallet, as you say, and I made it out to Peggy Del Mar, dated April 30th, 1985. I signed it. I said, if I go to work for any other hospital except yours, tell Peggy to fill in a number and buy whatever she wants.
You know, it's a big difference, you know, running a law practice and running a healthcare system. How do you decide, it was 5 years later, how do you make the decision that you felt it was about time to leave dealing with all the clients to really work with one entity over there?
You may appreciate this more than anyone. I was a lawyer, and all my clients were my legal clients, but I gave business advice. I maybe could be disbarred for saying that now, but the truth was, I sat down with hospital CEOs and we talked strategy and finance. And so I always liked the idea of managing a business. I grew up in a business environment where it was small enough to actually manage it if you wanted to do it. And so it wasn't the pursuit of justice in the law for healthcare that I was after. I wanted to help these institutions and physicians be more successful within healthcare.
Right, and you were, I mean, as we were saying before, the 80s were the turbulent times, you know, with, you know, the HMOs,
right.
You know, we had United Healthcare, we had, you know, well, not U.S., it was U.S. Healthcare.
HMO of Pennsylvania when it started.
Right, you know, Lenny Abrams'
right.
entity over there. And, you know, there were questions and people, they were accustomed to major medical, and now you were over here and you had to go to this doctor and people didn't know. And then there were DRGs, diagnostic.
We invented them in New Jersey.
Right, and New Jersey was the state over there. And then, so what happens? You're having dinner one night with Ron?
Well, Ron and I spent a lot of time together because St. Barnabas needed an awful lot of work. We were out lots of nights convincing physicians to move their practices to Barnabas. And one night in November of 1990, we sat down at one of our favorite restaurants, and Ron announced to the waiter who always brought us our drinks that there'd be no such thing until I agreed to come to work for him. I said, Ron, this is an ambush.
Now, was the check with him?
And he didn't show me the check at the time. And Ron said, look, you have to do this now. I want to grow. And we didn't. So sure enough, we negotiated a deal literally at the dinner table. And I agreed to come to work in April 1991. So it was like a 6-month notice for me to extricate myself from the practice.
Now, you joined as a senior vice president and general counsel.
Correct, right.
So
primarily, it was for business purposes. And I was a lawyer, so I took the general counsel. But it was that first day of work when I showed up on April 1st. I got to my office, and on the desk was this check I had made out to Peggy Del Mar. They had kept it those many years. And of course, now I have it, and that's what I showed you today.
So when you joined the Barnabas Health, it was Barnabas Hospital.
It was St. Barnabas Medical Center.
St. Barnabas Medical Center was about 350 beds?
No, it was bigger than that. It was about 550 beds, but it was one hospital.
So talk to me about the growth. You know, over the last, it's 24 years this year.
That's unbelievable.
That you've been over there. Let's talk about the growth.
So you'll appreciate this because you just said it. We're one hospital, And back then, there was a lot of talk about changing the reimbursement system so that you would have to live on something like capitated payments, and you needed a full network of hospitals and physicians if you're going to succeed. So Ron and I decided we'd go out and we would start to accumulate and build a system. So we basically went to a number of my former clients. We went to the Union Hospital first because it had a small hospital, 4 nursing homes, 2 outpatient centers, a behavioral health system. So we brought that into the system, merged it with our hospital, just to understand what would it be like to have a network of a variety of healthcare services. And from there, we started to launch the acquisitions of other hospitals and other facilities, all based on the fact that there was going to be a change in the reimbursement system, which frankly never occurred. When we initiated that, it instigated other systems in New Jersey that did the same thing. So you had a number of systems taking hospitals that had otherwise been independent and now created networks and organizations. Ours was the biggest by employment, by activity, by number of facilities, and it ebbed and flowed. We had X number, we closed a couple, we sold a couple, but it's remained a big system, ironically built for the first threat of a major change in healthcare reimbursement, which is happening now, many years later, just didn't happen to happen.
Right, but how has Obamacare and the current changes changed the nature of the Barnabas Health system and the operations over there?
I think the major principle that healthcare reform out of Washington is trying to, trying to protect is this notion that you need to get value for the money that's paid. And in order to do that, organizations have to be big enough to get the economies of scale and have to be widespread enough to cover large populations. And so having a big system is consistent with the health reform. Now, health reform is, in fact, reducing certain reimbursement and trying to insist on better quality and healthier lifestyles.
Right, and that's something that you've spoken about in numerous appearances on TV and in articles about. The focus is to keep people healthy. And if you're healthy, you won't be in the hospital, one.
Right.
There'll be less treatment. And then there's the ACO concept that you get paid a higher reimbursement from the federal government, right?
Well, at least you get paid a reimbursement that you can allocate to more appropriate uses than the way the fee-for-service system works. But as you just said, our mission in healthcare has changed. Our system, and I believe others, our mission is now keep people healthy. So population health management is not about sickness. It's about keeping people healthy. If you can keep enough people healthy, you'll have more than enough resources to treat those who get sick. People aren't going to be healthy 100%. So this is the way we've changed our business. We want to integrate with our communities, and we want to make sure we do things to invest in their health as opposed to their sickness. Our system for us has become a great platform to do that. Tough to do that as a single hospital. You need to have facilities, and you need to have geographic coverage.
But healthcare, when you started in '91, the average stay at the hospital was probably 6 to 7 days.
At least.
At least. And today, if somebody's in the hospital, and that's what I preface,
Right.
if they're in the hospital, because of the ambulatory surgery and everything, I'd say it's an average of 3.5 to 4 days. So
Tops.
Tops over there. And then, as we were saying, today it's more ambulatory care, it's more of a real estate business, it's more of a retail business, and even certain major innovations that you're doing with regard to insurance companies.
That's right.
This year you're planning to implement your own insurance
Well, we're
program.
going to announce a very special arrangement with Horizon Blue Cross, which will allow us to take premium dollars and allocate them in a way that is designed to keep people healthy, not necessarily wait till they're sick. But all that you've just said, of course, is a brand new mission for an organization like ours. When you were a hospital, and all you were was a hospital, you needed people to be in there buying your product called overnight stays. The technology, thank God, and the healthcare improvement means you don't have to be in the hospital overnight. But if the only product you have to sell is an overnight stay, you're not going to be in business very long. So here, diversifying away from inpatient is consistent with how to treat people better and be successful.
Now, in the interim of this, how do you end up in one day at the Yankee baseball training camp? I mean, you're running an institution over there.
Well, that was my real aspiration. If I could have played for the Yankees, life would have been different.
Did you get the baseball cards?
I got baseball cards, and yeah. So for a big birthday of mine many years ago, my wife gave me a present to go to Yankee fantasy camp, and I got to hang around with Mickey, of blessed memory. He was still around at the time, and all the other old timers. And it's one of those fantasies that it's great to live out.
And then what is this with the excavation?
Yeah. All right, so in addition to wanting to have been a Yankee, I always had this idea that it would be fun to drive construction equipment. So many years later, it was only a few years ago, my wife found an organization in Colorado where you can go spend the day learning how to run an excavator and a bulldozer. So we flew out to Colorado, and I have pictures of that with my hard hat and my lunchbox. And I'll tell you, that was a lot of fun, And maybe someday I'll be able to get back to doing that.
I think it's one of the principles of the Barnabas system that you and Ron and over the years is a very people-oriented first name approach and everything else. And also you've recently gotten very involved with the Special Olympics.
Yeah. First of all, at the extent to which I'm in the corner office, but I'm a GI general. It is a first name basis, and I want it to be like that. And we have a great cast, we have great colleagues, so that's terrific. Mission to us is helping people. Organizations of a certain size sponsor things, billboards at ballparks, all of which we do. I wanted us to make a commitment to a group of people who we thought was underserved, which are the intellectually disabled, and at the same time show people that this was our mission. So the Special Olympics came to New Jersey last year, the national games, and we were the founding healthcare partner, and we were able to sponsor the event with other sponsors. We had 1,200 of our employees sign up as volunteers day one, and I keep saying this to people, I've never seen anything galvanize our employees like this commitment to the Special Olympics. So for 8 days, it was terrific. But I'll tell you what's even better. Out of that commitment, we have changed the way we treat and welcome those with intellectual disabilities into our healthcare system who need healthcare services. So it turned out to be great name recognition, terrific. It turned out to be a mission-consistent support of something. And it turned out to teach us how to better treat those with intellectual disabilities. And I know your interest in healthcare and medical schools. We are going to the medical schools in New Jersey and offering to sit down and talk about how to include in their curriculum the kind of training you need for intellectually disabled people. So to me, it proved that you could latch on to something, not just having a blimp or doing whatever you do for notoriety. You can pick certain commitments and hit a grand slam, and we did.
Family. You've been married for what?
Be 41 years this July.
41 years.
July 4th. I have 2 children. Well, our daughter got married a couple of years ago, and our son is still looking for the perfect woman. He lives in the city, and our daughter and son-in-law live in the city as well.
And no grandchildren?
Not yet, but soon we hope.
And Mama is, as we were saying, in the hospital, working over there. She's independent living.
That's right. She's 91 years old. She just got a new car in January.
Hey, it's great. And, it's good that the kid who grew up in Newark, has kept his roots in Newark and Livingston, Short Hills, and soon, hopefully, with the Middlesex merger and
that'd be a great
the
thing.
affiliation. Thanks for being here today.
My pleasure. Thank you so much.